Hi everyone, I'm Dr. Dickson and today I'm going to share my basic skincare routine with you. This is really easy to follow. It only consists of 3 steps. Number 1, it is super important to wear a broad spectrum sunscreen every single day. I want you to wear the sunscreen even if you're not planning on going outside, even in the dead of winter. It is so important to help prevent the damage that the chronic sun exposure can cause in your skin, and it's super important to wear a zinc-based sunscreen. So what does that mean? It's a physical blocker, so it actually physically blocks the UV radiation versus the chemical sunscreens, which only blocks certain snippets of the spectrum. And also studies have shown that the chemical sunscreens do get into the bloodstream and we don't know what they're doing there. So super important to wear that every single day. And just remember that 80% of wrinkles are caused by sun damage. So put your sunscreen on every day on your face, neck, and chest. Number 2, it is super important to wear a vitamin C serum every single day. I want you to just use 3 drops on your face and a couple drops in your neck and chest. And that's going to help prevent any oxidative stress that occurs from the pollution outside, the blue light from our phones, and of course, UV radiation. So all of those things cause oxidative stress and damage to our skin. And so what these antioxidants do is they're already there to help bind up that damage before they can cause any problems to your skin. And I really like the IS Clinical Super Serum for most of my patients, and then the Pro Heal for my patients with any redness, irritation, or acne rosacea prone skin. And remember that not all vitamin C's are created equal. That I know you see a lot of stuff over the counter and at Sephora, and I always am going to recommend something that has placebo-controlled, double-blinded studies that actually show clinical efficacy and has proven to work in your skin. And so that's what I would suggest, that you speak to your dermatologist about any products you have questions about, or for some recommendations. Number 3, it is also very important to start using a retinoid every night if you're not already doing so. And remember, retinoids are not safe during pregnancy or breastfeeding, but they are very safe to use long-term otherwise. And retinols are going to be the less strong counterpart. They're going to be over the counter, so you can always start with this, but I do recommend bumping up to a clinical strength prescription retinoid if you're able to without getting too dry and flaky. And remember how to use a retinoid. All you need to do is use a pea-sized amount, dab on your forehead and cheeks, rub it in really well and evenly, and put a moisturizer on top, and start just a couple times a week. And then you can kind of work it up to every other night and eventually to every night after a month or so if you're able to. And remember to always put a moisturizer on top. That's going to help prevent any side effects. That's it, guys. That's my basic skincare routine. If you guys have any questions, please let me know. Thank you.